Good day, everyone. Did you know that more than 30% of dogs under 6 months of age shed roundworm eggs? In one study, 16.5% of canine fecal samples were positive for at least one species of parasite. Another study found that 54.3% of dogs had parasites in their feces. While many pet parents deworm their puppies as a normal part of puppyhood, the belief that dogs no longer need deworming once they reach adulthood is incorrect. Regular worming treatment is important for your dog's overall health. Nobody wants to think about their dog having worms, but unfortunately, worms are a common health risk for dogs. Puppies are even exposed before they're born. Part of being a responsible pet parent is keeping your dog healthy and parasite-free. Today, we will discuss the types of worms that can infect your fur baby and which of them can pose a threat to you if not managed. We will also discuss signs, symptoms, and prevention of worms, since worms are parasites to their host, meaning that they live in the dog, its host, and benefit by getting nutrients at the host's expense, thereby denying the dog from thriving to its ultimate healthy state. Please watch until the end to see which of these worms can be transferred to humans as well. The most common intestinal worms that dogs can contract are roundworms, hookworms, whipworms, and tapeworms. The heartworm is another type of internal parasitic worm that can be fatal to your dog. There is no worm as dangerous as the Spirocerca lupi, which lives in the dog's esophagus. It is also known as the silent killer. Let's discuss roundworms. Roundworms are one of the most common parasites found in dogs. They are usually a light brown or white color and resemble a strand of cooked spaghetti. These worms can live inside a dog's intestine and live off partial digested food. Puppies may be born with roundworms if the mother dog is infected. Puppies may also become infected from its mother's milk. These harmful parasites can also inhabit other organs, including the lungs, in the larval stage. Dogs can also contract roundworms if they eat or step on worm eggs or larvae. Hookworms, named for the bent fishhook appearance at their front end, attached to the wall of a dog's small intestines. Despite the fact that they are very small and difficult to see with the naked eye, they can consume so much blood that it can result in anemia in your dog. They also release an anticoagulant into their attachment sites, causing continued bleeding even after they have become detached. Dogs can become infected by eating the eggs, or the larvae can burrow into a dog's skin from the ground. A mother dog can pass the parasites via larvae onto her puppies in her milk. A dog could lick larvae off their paws after walking through a contaminated area. You can even inadvertently bring hookworm eggs into your home on the bottom of your shoes. Whipworms. These parasites have long necks and short bodies, which give them a whip and handle appearance. They live in the cecum and large intestines of dogs, where they bury their heads into the intestinal walls to feed. This causes irritation. A whipworm infection results in bloody diarrhea that can be chronic with bloody stools. They can cause weight loss and anemia. The microscopic eggs they shed with the stool can live up to 5 years in the environment and can infect or reinfect healthy dogs. Dogs become infested with whipworm by ingesting microscopic eggs from a contaminated environment like a dog park. Tapeworms is an intestinal parasite. This flat, segmented worm is found in dogs, cats, humans, and many other species, have a life cycle that involves an intermediary host. The adult worms live in a dog's small intestine, but the larvae live in another animal, such as a flea or rat. Dogs will eat the fleas while grooming themselves or consuming flea-infested prey or raw, undercooked meat like pork. The tapeworm uses its hook-like mouthparts to attach to the wall of the small intestine. The adult worms may reach up to 30 centimeters in length. A person must swallow an infected flea to become infected with tapeworm. Mild tapeworm infections might not have any signs, but usually, an infected dog will be unable to digest and absorb their food properly, leading to a range of problems. Symptoms of tapeworm infestations in puppies include a clinical diagnosis that is made by observing the white, mobile tapeworm segments in the feces or crawling around the anus. Occasionally, the entire adult tapeworm can be passed in the feces or vomited up, and it migrated to the stomach. These segments look like grains of rice or cucumber seed. Because you need to control the fleas to control the tapeworm, it's important to take flea prevention seriously. Heartworms. These parasites cause heartworm disease, which is a preventable yet potentially fatal infection that causes severe complications such as lung disease and heart failure. Like tapeworms, heartworms require an intermediary host, in this case, the mosquito. Mosquitoes pick up heartworm larvae from the blood of an infected host when they feed. Heartworms live in the heart and blood vessels, where they can interfere with heart function and clog the blood vessels, thereby reducing blood flow to other vital organs. Once infected, it may take several years for symptoms to appear in your dog, and once they do, the infection is quite advanced. Signs are often most noticeable after exercise and can include a soft, dry cough, weakness, and shortness of breath. This infestation can be fatal. Spirocerca lupi. This parasite is a deadly worm that lives in a dog's esophagus after a long journey through the body. On its journey to the target organs, esophagus and aorta, this worm causes serious damage. The parasite is ingested by your pet, consuming lizards or dung beetles, or small animals such as mice, rats, or birds. Once the lizards or dung beetles are swallowed, the parasite eggs hatch in your pet's stomach, after which they move through the intestinal walls and into your dog's bloodstream. Once in the bloodstream, the worm larvae will migrate throughout your dog's body, resulting in disease, and form a nodule in the esophagus. If this nodule is left untreated, it will cause cancer or a tumor in the throat. This slender reddish worm can become up to about 40 millimeters in length. Inside the wall of the esophagus, the constant irritation of the worms on the tissues leads to thickened growths of the wall. The presence of these granulomas cause regurgitation or vomiting in a large number of cases. Regurgitation is a passive backflow of ingested material from the esophagus, whereas vomiting entails the active contraction of the stomach muscles to expel food already in the stomach. A very interesting phenomenon that rarely follows these tumors is severe thickening of the fore and hind legs. Your pet will starve to death if this parasite infestation is not treated. Prevention is essential. Sudden death may occur with no outward signs of ill health. Prevention is the best course of action for worms in dogs, especially because dogs can be infected without showing outward signs. It's also important to pick up your dog's poop regularly and keep your dog's environment clean, as well as to prevent your dog from getting into hazards like dead wildlife or other animals' feces. Taking these precautions and practicing flea and heartworm prevention will help keep your dog healthy and parasite-free. Regular deworming is highly recommended to keep your pets free from internal parasites. If regular deworming is used, animals should be treated at least 4 times a year, with no more than 3 months between each treatment. Plus, you don't want worms passed on to you or your family members. Always follow strict hand hygiene when picking up your dog's poop. Always consult your vet for the correct deworming medication. This brings us to which of these worms can be transmitted to humans. Roundworms, yes. Hookworms, yes. Tapeworms, yes. Whipworms, yes. Heartworms, rarely. Spirocerca lupi, not known to infect humans. And of course, don't forget your family's health. Deworming your family is just as important, as several of these worms can be transmitted from pets to humans. Thank you for watching. Please take care of your fur babies. As a pet parent, you are obligated to ensure a happy, healthy pet. They deserve it. Please subscribe and feel free to comment below.